Mother-to-child transmission of HIV remains a significant challenge to Nigeria's goal of achieving zero new HIV infections, zero AIDS-related deaths, and zero stigma by 2030, with pediatric HIV accounting for 10% of all HIV infections. To address this, the federal government inaugurated the Prevention of MTCT and Pediatrics AIDS Acceleration Plan Committee. In her welcome address, the Director General of the National Agency for the Control of AIDS, NACA, Dr. Temitope Ilori, describes the situation as unfortunate despite past efforts.
Unfortunately, Nigeria faces a critical challenge in preventing mother-to-child transmission of HIV/AIDS and ensuring access to care for children living with HIV. Our epidemiological estimates, as at 2023, says that we have 140,000 children under age 14 living with HIV/AIDS, with about 22,000 new infections and about 15,000 AIDS-related deaths in Nigeria. Current pediatric HIV coverage remains alarmingly low at 33%, far short of the 95% target, global target. In 2021, the national and state level data, led to the development of the Nigeria's Global Alliance to End AIDS in Children Action Plan. This was designed to scale up PMTCT effort and pediatric HIV, addressing the coverage gap. But despite this strategy and accompanying financial commitment, our PMTCT and pediatric HIV coverage remains critically low.
Highlighting the objectives of the committee, the NACA Director General emphasizes collaboration to change the narrative.
The objectives of today's meeting is to formally inaugurate the Acceleration Plan Committee to provide oversight function to the prevention of mother-to-child transmission and the pediatric HIV program implementation in line with the three-point principle of our coordinating agency: one strategic framework and one M&E system. The government-mandated structures must be supported to lead implementation at all levels in line with the new business model and explore the multi-sectoral approach to ending HIV and AIDS among our children. Of course, as a family physician that I am, a mother, I also long to see that no child is born HIV positive in Nigeria. And as a DG of NACA, I know that I cannot do this alone, and I'm supporting, of course, the Honorable Minister for State for Health to say that together we can actually change this narrative and ensure that Nigeria will reduce the global burden of pediatric HIV in Nigeria. And AIDS-free generation is possible. Together we can achieve it. Thank you, and God bless.
Goodwill messages were delivered by representatives from community-based and non-governmental organizations, implementing partners, and relevant stakeholders.
We commend the government of Nigeria for the vision and convening us to address this urgent issue because it is an emergency. No child in Nigeria should be born with HIV, and we heard that from Madam Esther. The U.S. government is committed to our partnership with the government of Nigeria, our multilateral, our civil society stakeholders, to ensure that this reality that we've convened here today is achieved. If not Nigeria now, when? We have the right leadership to achieve these goals, and so let us collectively support that initiative.
And we want to invite all the stakeholders here to recommit, so if you can say it. We all say it is possible, but let's recommit in such a way that, so we can end AIDS by 2030. So in that, the entire UN system, so in Nigeria is committed. We are more than 3,500 staff. UN AIDS present in all the 36 states, so plus one, more than 40 sub-offices. We're really committed. And ending AIDS, syphilis, and hepatitis is possible in Nigeria. It is doable. Let's make it happen. Thank you.
Representatives of the state agencies for the control of AIDS, NACA, the health commissioners, and the Nigerian governors forums submitted recommendations and pledged their support.
So what we do at the Secretariat, we have series of scorecards that we use to track commitments made by governors. And at NGF meetings, we'll try to follow on those scorecards. So whatever, as part of the work of these committees, if there are commitments that are expected by the states, we will transfer it in the form of scorecards, which will always track and update the governors so that they know what is happening at any point in time and whatever the key actions that are needed to be done so that they need to be informed, and then they will make sure that they create the right environment for all those team and the states work.
Can assure that for us as states, 95 remains our principle, consistent with what everybody in the room wants, and we will continue to move in that direction. My final point is really just to appreciate all our partners who have really worked with us to get us to where we are here. The US government, comprising of the entire PEPFAR, the US CDC, and the entire team, Global Fund for a significant amount of resources that have been put into place. Of course, my own very dear brother, UNAIDS, and all the other players within the UN government. And finally, I really do look forward to the committee. I do hope that this is not a committee that just meets. I think that it has to be an active committee, and we're able to see the result.
This excitement that we're having this morning, the question is, how do we translate it to results at the state, at the subnational levels? How do we translate it into success at the world level? It's important for us to think about this. Then there's something also we need also to look at. How do we remove user fees for our pregnant women? We've been talking about it. It affects accessibility, whether we like it or not, especially at the villages and all that. Then another one that I also need to quickly talk about, probably is a long term, but we need to look at it. We train people on PMTCT all the time. How do we mainstream PMTCT training into community extension workers? They are the doctors you see and nurses you see at the villages. You hardly can see medical doctors at the villages. So how do we translate this training? I thank you very much. I pledge the support of my colleagues to this. Thank you very much.
The wife of the Kwara State Governor commended the Federal Ministry of Health for the initiative, describing it as timely.
The statistics surrounding mother-to-child transmission of HIV and pediatric AIDS in Nigeria from all accounts are alarming, hence the propriety of today's event, as it will no doubt bolster efforts and improve interventions in this regard. Also, the strategies laid out in Nigeria's Global Alliance to End AIDS in Children Action Plan are both necessary and timely, expanding prevention of mother-to-child transmission services, implementing targeted outreach programs, and prioritizing testing for children, which are equally vital steps in the right direction. As critical stakeholders, the Nigeria Governor Spouses Forum is committed to supporting this drive with a view to achieving this important national milestone. While I congratulate the committee, permit me to commend the Federal Ministry of Health, the National Agency for the Control of AIDS, and all other very important partners for all the work that culminated in today's launch. Together, it is my sincere belief that we can ensure an AIDS-free generation in Nigeria. Thank you very much.
In a speech, the Minister of State for Health, Dr. Tunji Alausa, said that the elimination of mother-to-child transmission of HIV is a moral obligation for the administration.
Eliminating mother-to-child transmission of HIV and ensuring care for all persons living with HIV, especially our children, aligns with our renewed hope agenda of Mr. President, President Bola Ahmed Tinubu. That's why the Ministry of Health is focused on the health sector renewal initiative. This initiative is centered on 4 main pillars: effective governance, improving our population health outcomes, unlocking the value chain of our care system, and seeing health beyond the prism of physical security, but as part of our social security and national security. To the National Agency for Control of AIDS, NACA, and the National AIDS and STI Control Program, NACA, we will provide effective governance for this program, working with all our partners and other departments within the ministry. We will facilitate efficient, equitable, and quality health care for all our children. This will ensure that no child is born HIV positive and that those who are positive receive quality care.
Speaking further, the minister outlined the thematic pillars of the PMTCT and Pediatrics AIDS Acceleration Plan.
In line with global best practices, I will inaugurate this multi-sectoral committee comprising technocrats and bureaucrats to ensure we deliver on this mandate, tracking implementation along the 4 pillars of our plan. Early testing and optimized comprehensive high-quality treatment and care for infants, children, and adolescents living with HIV and children exposed to HIV. Closing the treatment gap for pregnant and breastfeeding women living with HIV and optimizing continuity of treatment towards eliminating vertical transmission. Preventing and detecting new HIV infection among pregnant and breastfeeding adolescents and women. Addressing social and structural barriers that hinder access to services, while primarily addressing mother-to-child transmission of HIV and pediatrics HIV. This initiative would also improve our antenatal coverage, health outcomes for women of childbearing age, and under 5 mortality rates.
The inauguration of the PMTCT and Pediatric AIDS Plan Acceleration Committee marks a critical step towards addressing the challenges and ensuring that Nigeria meets the global target of eliminating mother-to-child transmission of HIV by 2030.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center, toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng.